right away, please shed some light on what that actually means in the field of dentistry. Why would dental patient need hypnosis or anesthesia? And how
Right.
often does that actually happen? Like, out of 1,000 patients, is it one? Out of 1,000 patients, is it 200? What are we talking about here? Well, hello, I'm Elwood Flash, and I'm here with Dr. Neal Johnson, a dentist in Riverside, California. That's near Big Bear in, good skiing area, as far as I remember. Now, Dr. Johnson is a dentist, and Dr. Johnson, I want to ask you one of question, because it says here that you're the founder of hypnosis and dental anesthesia. Right away, please shed some light on what that actually means in the field of dentistry. I'm sure there's a lots of people who do not quite connect those things, what that would mean to them. Tell me,
Oh,
Dr. Johnson.
absolutely. Sure, absolutely. Although I'm a dentist by training, I also had specialty training in anesthesia. So I provide anesthesia services for dentists in the office. So sometimes sometimes patients would go to the hospital or a surgery center to get their anesthesia done, but that's not necessary in all cases because I, as a dentist anesthesiologist, and my other colleagues provide those services within the office for dentists. So what that means is that I did go to dental school, and after that, I did actually practice for a number of years in the office, and then went back to train for anesthesia and sedation, which took about 2 years. The training is normally overall 3 years after you're finished dental school, and that trains you in all aspects of sedation and general anesthesia to be able to provide that service to the public. So that's exactly what I do every day, all day.
All right, doctor. Wonderful. Now, the question might arise, at least to me, why would dental patient need hypnosis or anesthesia? And how
Right.
often does that actually happen? Like, out of 1,000 patients, is it one? Out of 1,000 patients, is it 200? What are we talking about here? And what's the main reason? If you tell us that in a short way, please.
Oh, for sure. Look, well, two-thirds of individuals actually have some type of dental phobia, right?
Mm.
So they manage that in several different ways. They may have cognitive behavioral therapy, they may have hypnosis, they use distraction training, all kinds of different things in order for them to see the dentist and get the care they need. So within that population, that also includes a lot of kids and children who, by the virtue of how small they are, can't cooperate to get their teeth cleaned or filled or whatever the case is. And then there are a subset of individuals who may be autistic or have some developmental delay that will never sit in the chair to get stuff done. So it's a large percentage of individuals who need the care. They need anesthesia in the office. And that's what I and my colleagues provide.
Interesting. So would I be very wrong to assume that if that maybe if people would know more about it, and maybe they do, maybe just I didn't really know about it, but if people would actually know more about it, just like when we get a headache, we take an aspirin or whatever, and
Right. Right.
we take a lots of different medicines to avoid different anxieties or pains or discomfort or whatever it may be. So instead of delaying dentistry, which most people do know is not a real good thing. And there are many
Correct.
other reasons people delay it. We get that. But let's just say the ones who I really don't want to go to a dentist, that if more people would know about this benefit which exists, that maybe more people would take care more of their teeth and their health in that case.
Well, it depends. I would say I think a large number of individuals are aware that there are options that exist to be able to get their dental work done. But what it usually boils down to is that many people hear from their friends, or I had a horrible experience at a dentist, or they may have had some childhood trauma in some regard, or they may be embarrassed because they're like, I don't like how my teeth look, or whatever the case is. There's several reasons why people may delay or not do things, even though they know their options, right? So the key is sometimes trying to convince people, look, here are the list of options. We think this will be a good one for you or your child. And if you don't do this, then clearly you can end up with other bigger problems later. That is, oral infections that progress and cause significant morbidity or mortality. And there have been documentary reports of where children have died or been hospitalized because they've had untreated dental infections. Sometimes children get teased at school because their teeth look funny, all those kind of things. And the parents don't take them in because the parents have their own fears and pass that on to their children. And as a result, they nor their kids get the care that they need, given the fact that there are options for this stuff to be done. Now, let me make sure I give a caveat to that. Not every single adult or child is a candidate for in-office anesthesia. Okay, so even though that option does exist, not every person is going to be a candidate, because we still need to be safe. We still need to make sure that we follow all the protocols as you would in any facility, that you meet the criteria to be seen in an office setting. So that's another area that we can also explore and talk about. But it is a pretty safe procedure. Thousands of these are done every day. And we try to get the word out to more patients, and the dentists themselves know these options are available. So I think people do know. Can more people be aware? Yes, for sure. More people can always be made aware. But I think that people, for the most part, are aware that there are options available to be seen if they're fearful of coming to the dentist.
I got it. I actually think, however, because many of us people are very often aware of certain things, but need to be reminded, because when the
True,
time comes, we
true,
don't remember. I mean, my
true.
wife and me on a Sunday morning, we sit, and that being in Northridge in Los Angeles for all purpose, right? And we sit on which restaurant should we go have breakfast, and after 2 hours, we come up with a restaurant, usually the same one we always go. And by the time we finish eating, oh, we would have gone to that one also.
Yes,
We never
yes,
been it, wanted to go already for 2 years. And
yes.
sometimes we don't. All right, doctor, this was very nice. We will do we'll have a few more questions, but in different videos. Thank
Okay,
you very much.
you're welcome.